respectfully reject the proposition that accreditation stifles innovation. Over the past 150 to 100 years, accreditation has evolved to be a powerful force, assuring the quality of health professions education across the United States and many other countries as well. I assert that accreditation, well-defined and implemented, sets in motion a process of continuous quality improvement that is responsible to changes in science and technology and generates innovations in health professions education. Whether or not the professions intentionally heed the call for disruptive innovation, the educational system is challenged by societal demands as well as the populations we serve, technology and knowledge as well, to have an exponential growth in innovation. The need for innovation in teaching, learning, and higher education has never been greater. Accreditation is a critical influence on the development of responsible innovation. Innovations emerge in education and business, come together in terms of business case for educational innovation. We've seen the commercialization and exponential growth of products from the private sector. And the for-profit system of healthcare has made education both more accessible geographically, temporally, and financially, challenging the nonprofit systems for change. Accreditation, though, however, is the system by which we assure that the processes of education are both of quality and that we innovate responsibly once again. As we look forward towards the priority areas of innovation, such as interprofessional education in particular, new models of clinical education, competencies, technologies, we see the importance of accreditation, as current accreditation standards and processes across a range of health professions are guiding these, accelerating the trends to address these important issues for innovation. Whether the innovations of IPE, new models of clinical education, or dedicated educational units, the use of simulation, the accreditation standards and process have provided support and increasing flexibility to assure that student learning and quality program outcomes serve the health professions not only for today but for tomorrow. Accreditation is supporting pilot programs, for example, the dedicated educational units, collaborative practice models such as the VA has sheltered, and we're seeing the replication of these models across the country. Yes, there continues to be a variability in the degree to which innovations, including the domains of IPE, have been integrated, but it is a work in progress. Absolutely, accrediting agencies are increasing efforts to better coordinate and assure that the call from the health professions to bridge to quality has not only been heard, but it's been responded to. Accreditation has spurred and supported pilot programs, including evaluative processes to ensure that measuring outcomes as well as identifying and removing barriers is done. We need to identify the best practices, and we're on the road to doing that in our accreditation processes. As noticed in a recent scoping study on innovation, that there is a healthy growth of innovations in accrediting institutions such as simulation, competency-based curriculum, online hybrid learning approaches, and learning-intensive high-impact pedagogical processes such as PBL, project-based, and team-based learning. There is amazing growth that we've seen over the last 10 to 20 years, and and accreditation has certainly supported these. Innovative models based on competency and currently evident in the revision accreditation standards. Accreditation both promotes and responds to calls for innovation. This competency focus includes e-learning, distance learning models that provide accessibility to students and enrich the workforce areas in areas lacking on-site bricks and mortar programs. The willingness of our accreditors, which we're seeing, is to consider and approve these different models for competency-based education helps the health professions, educations, and educational institutions to think about how they can innovate responsibly. Accreditation and the support for innovation is a balancing act. While the primary focus on accountability to the public and the quality of programs, the Lancet Commission on the Education of Health Profession has called for social accountability as well. That directs the health profession educators to address global priorities as health disparities, population health, and quality and safety. Accreditation is the vehicle, I assert, it is the important vehicle that is now assuring their integration along with the responsible adoption of innovation. Is there more to be done? Absolutely yes. While it would be simple to accept the premise that accreditation stifles innovation, the reality is much more complex. The factors that stifle innovation in health professions are myriad. In a 2000 report by Spector and Odom on barriers to innovation in nursing education, for example, educators responded that the processes of their own communities and university hierarchies can impede innovation, and as can faculty and student attitudes and the culture of practice sites. Accreditation is a powerful modality that does ensure continue to stimulate responsible innovation that prepares healthcare professionals for the future as well as today. So in closing, I affirm that, in fact, we should continue to support accreditation and their efforts to accelerate innovation. And as I paraphrase a World Bank report, in the end, most would agree that the quality, creativity of higher educational institutions, to the extent that they have it, comes from the excellence of the faculty members and the nature of the environment, the academic support of students, faculty that receive. To that extent, their efforts are fettered by external regulations. We have to worry that their creativity in teaching might in fact suffer, yet there is a need for external stimulation by accreditation. Even if at times it seems an unwelcome intrusion, it points to the importance of maintaining world-class standards, better teaching, first-class research, and the ongoing dreams of innovation. The challenge for quality in accreditation higher education is to find the proper balance and between the external demands for quality and the creation of the conditions and the freedoms that allow the genius of health professions education to flower however it should and innovate. Thank you.
Great.